I'm Ann Young. I appreciate being here, and I'm not a native of Shelby. Actually grew up in the mountains of North Carolina, but I've been in Shelby for 42 years, all of my married life, so I call Shelby home. I had an injury in mid-May. I fell, tripped over a piece of luggage, very boring, no zip lining or anything like that, and I actually had a mild concussion from that, and then the tear to my rotator cuff and injury to that muscle in that arm. And so we kind of waited a few weeks to see if it might start healing, and it didn't. And so then I got the word from Dr. Hayes that I really did need to have that fixed, and so then we began the process of surgery. But it was hard to move it. It was hard to lift anything. Just your normal day-to-day. Driving was very difficult. So it became pretty apparent by that third week or so that I was going to be really disadvantaged in being able to use my right hand and arm, and I'm very dominant right-handed, so that makes it tough, just to do day-to-day things. I found out after this happened that there's a lot of people that have had rotator cuff tears, and my medical doctor said, you need to see the shoulder man, and that's Dr. Hayes. So he ultimately is the one that led me to him, but I have had very good comments about him from others. Now, I've never been in Kings Mountain Hospital personally, and don't really know if I've even been there visiting much, and so I didn't know where to go, and I went in the front door and I just said, I'm here to do pre-op for surgery tomorrow. And two gentlemen behind the front desk, the elder gentleman explained where I was going, and he said, and this young man's going to take you. So he actually escorted me over to the elevator, up to the room, this is the waiting room, and let me get so-and-so, and within just seconds she was there. And then he went back down, he wished me well. I think when I walked into that lobby area, I felt it then that, things were really going well. And when I met this girl, and I'm not positive of her name, but I knew it within seconds. She was so professional. She informed me of everything, things that probably wouldn't make a difference to a lot of people. I'm a retired human resources professional for over 30 years, and detail is important to me. We really like him. He does great with his patients, and he'll take good care of you, and we will too. And from that point we went on to the lab, and she's a nurse, so she actually did my blood work and all, so it was kind of a whole complete package. We talked, we had some things in common, and she really just reassured me. I felt more of that peace coming over me. I remember talking to the two nurses that were in my room, and they were like almost like an assembly line. And it was like, if you ask about this, then I'm supposed to ask about this, because you could just tell the way they went back and forth. Did you do this? You got this? And it was like one thing always followed the other. But they were also very good to explain what was happening. We're doing this because I had an injection or a shot in my neck. That's a nerve block that blocked, down to my elbow, which is wonderful. And they had to explain all that, and the anesthesiologist came in, and he was very thorough. I have no idea what his name is, but they were with me in recovery too. And then back to my room, and then the family started coming in, and they just kept me informed of everything, even though I maybe at the time didn't realize it all, but I knew they were talking to me, and they were saying, Ann, you're going to do this, we're going to do this, you're going to do that. It was just information after information after information. Very professional, very caring. There were no orders barked from any of them. There was nothing like that. It was just very caring and making sure I understood. And I'm sure that I didn't, because of the condition I was in, but I know my family knew that. And then since that surgery, I've been in here, I believe, 3 times to Dr. Hayes' office for, follow-up appointments. And again, I just can't say enough about customer service. Again, my background's in human resources, and that's a big component of that. And I always said, because I did training in my former job, and I always had great examples of bad customer service when I would do my training. It was never hard to get bad examples, and these are very good examples. I could use them if I were still training.